we have a lovely message from Gloria Barrera, who will be sharing her message with us now, who is the current president of the Illinois Association of School Nurses.
Hello everyone and welcome to Comer's School Nurses Day. On behalf of the Illinois Association of School Nurses Board of Directors, I'll be sharing a quick update. We've been working hard to promote legislation to appropriate funding for a school nurse capacity study since January of this year, because as nurses, we know that data matters. To that end, House Resolution 817 urges the Illinois State Board of Education to work with IASN to complete a study to gather more in-depth data that can be utilized to develop a model for healthcare services provided in schools that can address specific community needs. Thank you to our members for your advocacy and support. These gains could not have been met without your work. We appreciate the tireless support of Representative Hirschauer throughout this process, and we look forward to continuing our efforts in the coming months to assure that the goals of IASN are met. It is my vision for IASN to have an inaugural annual School Nurses Day at the Capitol in spring of 2023, so please stay tuned for that. I hope to see each of you at our annual conference. We're celebrating 65 years of improving child health outcomes and school nurses leading the path towards health equity on September 30th and October 1st. Please head over to iasn.org to complete your registration. There's one more big announcement to share. IASN is raffling off 65 student memberships to celebrate the Year of the School Nurse and our 65th annual conference, along with the many scholarship recipients that we have for our current members. I've said it before and I'll say it again. As a school nurse working in Illinois, IASN is the organization you can depend on. Thank you for all your work over these past trying years. It is my honor to call you my colleagues. We have an incredible lineup for today's speakers. I want to give a big shout out to the leadership at UChicago Comer Children's Hospital for putting on this event and showing your commitment to professional education of school nurses. I also want to thank our generous sponsors, the Sunshine Charitable Foundation and the University of Chicago Culver Diabetes Center. This event could not be possible without your financial support. Thank you. Finally, I'd like to introduce you to our keynote speaker, a colleague, friend, and president-elect of IASN, Bridget Haroff. Bridget is a certified school nurse in the northeastern suburbs of Chicago. Her passion for nursing began while working as a pediatric clinical instructor providing a school nurse rotation in the district she went on to work for. She also has been dedicated to caring for children through her work as a pediatric intensive care nurse and a critical care transport nurse at 2 acute care hospitals, and now in supporting the daily wellness of students in schools. Bridget co-founded the Lake County District Nurses Leadership Group to build stronger relationships with the school nurse leaders in Lake County, as well as foster a strong networking group. School nursing has the potential to be an isolating profession. The group has grown from 2 members to nearly 30 members in the last 3 years. She is the nursing coordinator for the Barrington School District 220, leading an incredible group of nurses in the northern suburbs. Please put your virtual hands together for Bridget Haroff.
Thank you very much. I'm going to share my screen now. All right, welcome everyone. I am so pleased to be here today. As Gloria said, I am the president-elect of the Illinois Association of School Nurses, and I'm the nursing coordinator for the Barrington School District. Next, I will have my obligatory disclosure slide. I have no relevant financial or non-financial relationships to disclose to you today. So we're going to talk about school nursing and why we are essential. School nursing visibility pre-pandemic. If you think back, it seems like a very long time ago. We as school nurses were not necessarily at the forefront of everyone's mind. Looking back, there are really only 2 studies that even look at school nursing across the country. In 2006, less than half of all US schools had a full-time registered nurse, with about 10% of those nurses employing LPNs in some capacity. And then looking at 9 years later, we really didn't make much headway, and still only about half of schools had a nurse, and that nurse alone in a building, or on average covering up to 3 buildings, either in a week or sometimes going building to building in a day. So what we know is that there's extremely limited data on the number of school nurses who are working across the country. And more so, there's limited data on who that school nurse actually is, because we know that based on where you are in the country, the definition of school nurse can differ. Here in Illinois, to be considered a school nurse, you need to have a certification with a professional educator license. But in other parts of the country, it may be a BSN or an ADN RN who's working in the health office, an LPN. Some places use EMTs or even pharmacists, and we also have unlicensed personnel who are working in the health office. So as Gloria said in her welcome, we don't have a central database here in Illinois. So it's difficult for us to ask for more help when we don't really know what we're starting with. The general feeling pre-pandemic especially was school nurses are great, we're really helpful in a crisis, but on a day-to-day basis, not that many people think of us, and we're not really seen as a lucrative investment. So we need to talk about what we can do to change that. So once the pandemic hit, many school nurses began to raise their voice and bring increased awareness to our profession. One of those nurses is Robin Cogan from New Jersey. She is the author of the Relentless School Nurse blog that started in 2015. As the pandemic started, Robin was frequently raising her voice, especially on her Twitter profile. And she was famously quoted by the New York Times in July of 2020 as saying, "I'm going to say it. It feels like we're playing Russian roulette with our kids and our staff." And that comment went very viral and skyrocketed her into the public eye. She went on to be interviewed on several different platforms, cable news, podcasts, print journalism, and really helped to elevate the message of the school nurse that, especially during this time of the pandemic, we are on the front lines protecting students and staff. And there are things that we need to be successful, like PPE and protocols, but we also need to have a voice at the table when decisions are being made. Robin writes her weekly blog, and she also writes a column in My American Nurse, which is the official journal of the American Nurses Association. And then my colleague and friend who introduced me, Gloria Barrera, she also has gained significant notoriety on her voice as she's been raising that across platforms. Gloria is really, really good at speaking and sharing her message on Twitter, and I have been working really hard to try to get good at that myself. She's gained significant notoriety addressing environmental health issues as well as climate change issues. She's been working to spread messages about various health issues that impact our students on a daily basis. Gloria's work with multiple organizations has been recognized locally and nationally. And in 2020, she received the Pinnacle Nurse Leader Award in Illinois. Even more exciting, at least for me, she was part of a CDC video that was released spreading awareness about COVID-19 and the COVID-19 vaccine. And also in that video was Dr. Fauci. So really elevated school nursing to a national platform. And it was just wonderful to see that positivity for our profession. So as the pandemic went on, other school nurses here in Illinois began to speak out and raise issues. So in 2020, the then current IASN president, Juanita Graffinsky, was interviewed, and she shared her story with NPR. Myself and Cam Trout, we were interviewed by WBEZ in Chicago in 2021. And then Dr. Eileen Moss from New Lenox, she shared her story with the UIC Health College of Nursing in October of 2021. So school nurses are getting their voices out there to advocate for our profession, for our students, our staff, and that is amazing. Being asked to be interviewed is incredible, and it sounds daunting, and you may say, oh, I couldn't do that. What would I even say? You know, I'm not an expert, but you are. You can do that. You are the expert in your school. You are the one who has the knowledge, and you can share that knowledge with people across the country. So recently, the Future of Nursing report was published, and this is the first time school nurses were featured in the report. It was very, very exciting. Robin Kogan was asked to present to the committee regarding the importance of school nursing. And of the 9 recommendations, school nursing made it into number 5. Federal, tribal, state, local, and private payers and public health agencies should establish sustainable and flexible payment mechanisms to support nurses in both healthcare and public health, including school nurses, in addressing social needs, social determinants of health, and health equity. How incredible is that? There we are in this Future of Nurses report, because we can do all those things. We can address our students' social needs. We can address their social determinants of health, and we can help bridge the gap between students who are able to get what they need and those who are not. That's a huge, huge gain for school nurses, and everyone should be really proud. So what can you do as a school nurse? Well, first of all, you need to know your worth. You are important. You are an essential person working to promote health and academic success in your school building every day. So one way to get your message across and show how much you really do is to use your data. Because how often do we feel that the people in our building, our administrators, our community don't really know what we do? The perception is we hand out ice packs and Band-Aids, and we have a very easy life sitting in our office, reading our novels, and just enjoying life. But the reality is we are extremely busy. And the way to show that is to collect your data. Most schools use an electronic health record, both for academics as well as health. And through that electronic record, you can work with your IT department to run reports and pull together what it is that you do in a day. You can pull together the number of students with chronic illnesses in your school, because one of the big things school nurses do is we manage chronic illness. How about the number of times you've called 911 this month, this quarter, this year? The number of school visits that you have. Some nurses are seeing 60 to 70 students a day. You need to take credit for that. How about the time that you spend writing IEPs or 504 reports and attending meetings? All of these are important. You can put this data together and present it to your building administration, to your school board, and even on a national stand. We would love it if you would submit your data to the National Association of School Nurses for the Every Student Counts. They're collecting data so that they can take this to a national stage and show what it is that school nurses do every day. In addition to that, how many people are working outside of their contract hours, especially during COVID? I know I was taking lots of work home, nights, weekends. It was just work, work, work. So keep track of that. If you're working a significant amount of hours outside of your contract or consistently not taking a lunch, those are things that you can bring to your administration to talk through and see if there's another way to facilitate your being able to get a break. So maybe that means more staffing. Maybe that means a stipend. These are things you can do with your data. Another way to elevate yourself in the profession is to get certified. So here in Illinois, as I said, we have a school nurse certification. And our school nurse certification is written into School Code Section 25.245, which is the endorsement of the school nurse. We have a whole list of qualifications that we have to meet. We have graduate courses we need to take, a content exam to pass, and at that point, we receive a professional educator license with an endorsement in school nursing. This is important because written into our 23 Illinois Administrative Code, 226-160, is the medical review, which is a health evaluation for students who are being considered for special education. It's described as a 5-component process, and the purpose is to determine if any known or unknown medical or health issues may be present and impact a student's ability to achieve academically. This is a very important part of the IEP. And in our administrative code, it says that these components of the medical review must be performed by qualified personnel. And in Illinois, that's a certified school nurse. So certification is really important. I would say here in Illinois, many schools offer tuition reimbursement. So talk with your district and see if they will reimburse you for the cost of getting that certification. There are 2 other sort of loopholes that we have here in Illinois, and I would caution you if your district is asking you to do either. The first is the IEP designee status. So with the IEP designee, a school nurse takes a 6-week course to learn about the medical review, and at the end, they're able to do that work. In addition, there is a short-term approval qualification where it's very similar and you can do the work of a certified school nurse without actually being certified. So I would caution you with that, because if you're doing the work of a certified school nurse, you should be paid to be doing the work of a certified school nurse. But if you're an IEP designee or you're doing the short-term approval, the district doesn't have to compensate you for that work. So I would ask a lot of questions, and I would highly recommend that if you have a passion for school nursing, that you do your Illinois certification. In addition to our state-specific certification, there's also national certification. And some districts will actually offer a stipend commensurate with the national teacher certification, which means you would get an additional stipend on top of your yearly pay scale because of your national certification designation. And I will tell you that the window to register for the fall testing just opened yesterday. And Gloria Barrera and I have made an agreement that this is the year we're going to do it. Neither of us is nationally certified, and it's time. So I challenge all of you who are not nationally certified to sign up with us to take your exam and then come to NASN in 2023. It's going to be in Orlando, Florida, and we can all celebrate being newly nationally certified school nurses. This is a great way to not only show that you are the expert and that you have the knowledge, but it also helps to elevate the profession. So here in Illinois, we have 4 different programs that offer the school nurse certification: DePaul College of Education, Illinois State University, Lewis University, and the University of Illinois Chicago. I've included here contact information and websites for all of the programs. The UIC, Lewis, and DePaul programs run on a traditional college schedule. So there is a spring and a fall, or a fall and a spring semester. So 2 semesters that you would complete your content course and then do your school nurse internship where you work as a school nurse in your building. The Illinois State University program is the newest of the programs, and that one actually starts over the summer. So you complete the majority of your content work over the summer, and then you do your internship in the fall. I would highly recommend that you take a look at these websites, get some information, and ask lots of questions. Here in Illinois as well, you can apply for a mentorship through the Illinois Association of School Nurses Foundation. So if you are a member of IASN, you can request a mentor for 2 years. And that may be because you're a brand new school nurse, you've never worked as a school nurse. It may be that you're a new CSN and you're looking for mentorship. But it also applies if you're changing where you work as a school nurse. So if you've spent your career working elementary, now you're going to high school and you don't know where to start, you can apply for a high school mentor to help guide you through that transition. It's an excellent program, highly recommended. And as Gloria mentioned, our foundation has lots of scholarships to give away. So I would definitely recommend you check it out. Next is professional membership. I know this is a hard sell because we all look at the price. Things are very expensive right now, and professional membership is one more thing that you're paying for. But I want to guarantee you that you're going to get your money's worth. In addition, you can talk with your district, and some districts will reimburse you for the cost of your membership. One of the reasons is that they benefit from the membership as well. So by becoming a member of the National Association of School Nurses, you also become a member of your state affiliate group, and you get multiple benefits. One of the big things is that NASN has a partnership with VSP, and they offer coupons, and you can request up to $25 a year, and the coupons are good for a full eye exam as well as a pair of glasses. And depending on where you work, that can be a huge, huge thing for students. How many of us have students who we have identified as not passing their vision screening? We know they need glasses, but their family just can't make it work. They don't have the money to get the glasses right now. The student breaks the glasses. They haven't had new ones in 2 years. These VSP vouchers can be a huge life changer for that. On top of that, NASN has an incredible library of professional development opportunities. They have many different PDs that are recorded and you can watch on demand, as well as things that go on during the year. These are sometimes virtual and sometimes they're in person, like the in-person conference that we just had last month in Atlanta. And it was incredible to be able to gather with school nurses again and network and hear what's going on in different states. NASN has some really helpful toolkits. So if you are a school nurse, you don't have a really solid medication policy or a seizure policy or diabetic policy, NASN can help you. They have some incredible toolkits that were put together by school nurses across the country who have amazing expertise and have put these school toolkits together, and they have everything you need. I highly recommend you go and check them out. And advocacy, being a member of a professional association can help you advocate for your students and your staff and even yourself. So different professional memberships include, as I said, NASN and your state affiliate, as well as American Nurses Association. So here in Illinois, you can join ANA Illinois, and they have been very strong partners with the Illinois Association of School Nurses. We've really built up our affiliation, and we are working together to help spread the message about school nursing and bolster the profession. In fact, this winter in March, Gloria and myself and Cam Trout, we were asked to come and speak about school nursing staffing at the Staffing Summit, which was incredible because when you think of nursing and staffing issues, you think of the acute care setting, but the reality is that we have staffing issues in the school setting as well. And it was really great to get that out and to help educate other nurses about our struggles and what we've done to overcome them. Oops. Sorry. Okay. So as Gloria talked about, the Illinois Association of School Nurses has been working on some legislative advocacy. And I know what you're thinking. Ooh, legislative advocacy, politics, it's not my thing. And I'll tell you, it wasn't my thing either. But having participated in this and started working with the legislators, it's been extremely interesting. And it really wasn't as scary as I thought it was going to be. So, as I said, I started increasing my school nursing social media presence. I made myself a professional Twitter account, and I started retweeting things from National Association of School Nurses and the Illinois chapter of AAP, things like that, and sharing messages. It's as simple as tweeting something out, like when Gloria and I met with the athletic trainers of Illinois. It was incredible because I realized I didn't know as much about what the athletic trainers did as I thought I did, and they had the same feeling. So it was great to be able to partner and to share that we were doing that. You can connect with your legislators on Twitter. It is very easy. You follow your legislators, and if you've got something you want them to follow up on, to take a look at, all you have to do is tag them in your post. So when we were working on our House Bill 5601, we were frequently tweeting out messages, connecting with our legislators. And our lobbyists had come to us and said, it would be really great if you could have dinner with the legislator who is sponsoring your bill. And it just so happened that I was going to be in Springfield. So it was me in the hot seat. And I was very nervous because I'd never really met a legislator before. And I will tell you, Representative Hirschauer was just the nicest person I have ever met. So easy to talk to. We just had dinner and talked about why school nurses are important and why we felt that we needed this comprehensive school nurse study. And it was incredible. I really felt like I was able to connect with her. She's got an education background, and it was great. So we had multiple legislators sign on to our bill. Unfortunately, with the ESSER funding, the money had already been allocated to our state school board. And so our House bill became a House Resolution 817, which urges them to partner with the Illinois Association to get this school nursing capacity study done. And they were given a deadline of January 10th. So we are hoping to work with them to get that completed. And if not, we are going to continue to ask our legislators to invest in school nursing. And we're ready to do that come next year. So I would really encourage you to start reaching out to your stakeholders in your community and getting your message out there. When someone asks you to share your expertise in a poster presentation, an article, a blog, a podcast, an interview, don't hesitate. You are the expert. You know what's going on. You have the knowledge. You can share it with others. In addition to that, I would recommend that if you are feeling isolated as a school nurse, because we know working in buildings by ourselves, it can be very daunting. I encourage you to reach out to others in your community, in your regional area, and build a professional network. As Gloria said in my introduction, myself and my good friend Donna Bradbury, we started the Lake County District Nurse Leaders Group. So Donna and I met at one of our IASN conferences, and we realized that not only were we essentially work neighbors, but we were functioning both in the same position. So Donna had a great idea that we should start getting together once a month to brainstorm and to talk through issues that we were having and work together to find solutions. And we continued to do that for about a year. And then we pulled in the administrator of our special education co-op, Sue Kreckman, and the three of us continued to meet once a month. And it was extremely beneficial. We had an agenda. We knew what we were going to talk about and how to problem solve. And as we continued to do that, word spread through the county and more nurses wanted to join. So we opened it up. We met a few times in person and then COVID. And so as we were at home, we realized that we needed to continue to meet and reach out. And so we went virtual. And by doing so, we were able to have these meetings with even more nurses across the county. And by working together, we were able to take our questions and concerns to our local health department. And they reached out to us and they were able to have meetings with us so that we could share feedback, build policies, and help to make decisions for the COVID protocols across the county. So I highly encourage you to build those community networks. And if you have questions, I would be more than happy to help you work through that to build up those networks. So what resources do you need as a school nurse so that you can get your message out there and have all the knowledge you need? I listed a few here. So the first one is our Illinois School Board school health page, NASN and IASN, the NBCSN, where everyone's going to go to sign up for their national certification test, right? Because we're all going to do that together and it's going to be amazing. And then I listed the Relentless School Nurse here as well. So on the NASN site, when you are a member, you have access to the School Nurse Net, which is a virtual listserv where you can go to search for information, you can post questions, you can comment and share information that you have. And you can do that in a couple of different ways. You can join the national conversation, you can join your state affiliate conversations, and then there's special interest groups that you can join as well, depending on what you do. So for me, I am a member of the school nurses special education group, as well as the school nurses administrator group. And I have learned so much from being in those groups and reading through those discussions. And I don't even have to log in every day. I set up my profile so that every morning it sends me kind of a little snapshot of what's going on, so I can take a look and see what discussions are happening and if there's things that I want to look into. I'll also tell you that when I started as a school nurse, I didn't really have a whole lot of information, probably a lot like you. And I went online to try to find some resources and some guidance to help me understand what I needed to do as a school nurse. And I couldn't really find what I was looking for. So a couple of years ago, IASN gathered a group of really awesome nurses together, and we looked at our website and we completely revamped it. And we have a wonderful resource page that will help link you to various different policies and information that you need as a school nurse. This is especially specific to Illinois nurses, but nurses across the country, there's probably some things in there that will be beneficial to you too. So I encourage you to check us out and see if there are things on there that you have been looking for and now you've found them. In addition, if your state is running a school nurse specific conference, I highly recommend that you participate. Again, a lot of districts will help to pay for the cost of PD specific to school nurses. And unlike other PD that you may be provided in the district, having something that is specifically aimed to your profession can just really help with your practice and again, help build those networks. So I highly encourage you to attend those. Here in Illinois, as Gloria said, this is our 65th year, our Sapphire year. We are very excited for our conference. We've got some great speakers lined up. So I encourage you to join and sign up September 30th and October 1st. We are raffling off memberships to our students. So people who are getting their certification, people who are pursuing their BSN, their MSN. If you qualify as a student, you can get a one-year membership to IASN. And on top of that, our foundation has a ton of scholarships to help pay for the costs of continuing education. So please go on the website, take a look. We would love if you would apply for those scholarships because we want to give you that money. So take a look. Here is a list of my references from my slides and then contact information, including that Twitter handle. So I would love to reach out to you. Follow me on Twitter, send me an email if you have questions. You are the expert. You are the one who has the knowledge. You know what you're doing. You need to share that. Share it with your administrators, with your community, with your state. Thank you for all that you do. Our students and our staff are so lucky to have you. And I am just thrilled to have been able to talk with you all today. Thank you so much.
Incredible. Thank you again, Bridget, for everything. What a fantastic presentation. We're so honored to have you with us and to be our keynote for the day. Just great to start the day with so many ways that we can advocate for ourselves as nurses and for those we care for. Stay tuned for more. Of course, Bridget will be joining us later, and certainly stay in touch with her. We are going to move forward. But we do have a couple of minutes. I mean, I do have 4 whole minutes. So a really great question, Bridget, maybe you could answer this now from Suzanne. Where does the funding come from for those mentorships and for those scholarships? Where does that funding come from?
That is a great question. Thank you. So our foundation raises money through our annual conference, through raffles, and then we have started presenting town halls. So virtual presentations are about an hour long. We do one every 2 months or so, and we've been able to get sponsorships for those town halls. So that money goes to our foundation as well. And in Illinois, before we restructured IASN, our state was divided into different divisions, and each of the divisions had a division president and they had a division budget. So when we restructured, those divisions took the money that was left in their budgets and they allocated it to specific foundation grants and scholarships. So it's definitely a great idea to go and look, because if you are in one of those areas, there may be a whole bunch of money that's earmarked for someone just like you. So please go on and apply, because we would really love to give you that money.
Fantastic. Great question. Another really good question. A nurse pointed out that she is being, I guess she's frustrated by the process of trying to get hearing and vision certified in her district. She's got 3 nurses trying to screen 5,000 patients, and you'll see more information in the Q&A from her. But do you have any advice for her?
I feel your pain. Historically, getting certified for hearing and vision in Illinois has not been an easy feat. So I would just recommend that you are persistent and present the needs of your students. And if you have staff who can serve a underserved population, even better. So just make sure that you're letting them know. I also am struggling with that, and I applied to get some of my nurses certified and was told probably not, but I am persisting, because I have one nurse who is Spanish speaking, and she works in a predominantly Spanish speaking school. And for her to be able to give that hearing and vision screening to her students in their native language is huge. So we are just continuing to ask the state, and we're going to work with them, and through IASN we can try and take that case to the state as well to advocate for more screening opportunities.
That's great. I appreciate that. Lots of local folks, both local in the Cook County, Lake County area, but really the groups that you want folks to join would be their local school nurses association through the state that they're in, correct? So
yeah. Okay. So when you join the National Association of School Nurses, part of your membership fee also pays for you to be a member of the state affiliate group.
Great. And should you advocate or ask your school district to cover the cost of your membership?
Absolutely, because that money can be seen as being paid for your PD, because there's so much professional development available through NASN and probably your state organization as well. But also because of those VSP vouchers, that's 25 students who could be getting vision screenings and glasses for the district. So I would definitely use that as a sell as well.
I appreciate that. Lots more questions as we wrap up, Bridget, that maybe we can work on with you separately and with your team to think about ways that we can improve vision and hearing screening to increase instructors outside of IDPH. We have lots of questions in the Q&A today around hearing and vision screening. So maybe that's something we can work on in Illinois and in other states, but that seems to be a top priority in the questions and in the chat today. So Bridget, again, thank you. What a pleasure to have you, and certainly to have Gloria open things up and to introduce you in such a beautiful way. We look forward to seeing you soon.
Thank you so much.
Of course. Our next session, or our first session for the day, is really a focus on mental and emotional health throughout this COVID pandemic. We have been at this now as nurses, as parents, as advocates for children for over 2 years now. During the COVID pandemic, we've seen quite a bit change in the mental health space. And I think one of the ways that we can have this conversation is to talk to some experts around COVID, around navigation of mental health, and thinking about how we can improve things for our kids in our schools. First, though, we are going to have one of our top experts on COVID and infectious disease talk to us. Dr. Allison Bartlett is a pediatric infectious disease physician, and she's the Associate Director of Infection Prevention and Control at the University of Chicago, Comer Children's Hospital. She's a member of the Society of Hospital Epidemiology in America's Pediatric Leadership Council. With that group, Dr. Bartlett has published several commentaries on pandemic-related topics, such as inpatient visitor considerations, personal protective equipment during care of children with multi-system inflammatory syndrome, and supportive well child care during the pandemic. In addition to teaching, she serves as a faculty member at the University of Chicago. Dr. Bartlett believes in the importance of communicating science to lay audiences and to provide accurate information, guiding all of us, especially school nurses, in decision making. These past 2 years, being available as a reliable, trusted source of information, Dr. Bartlett feels has been more critical than ever. She's given many interviews to news media addressing questions and concerns about COVID-19 infections, vaccination, and other mitigation efforts. We're thrilled and honored to have Dr. Bartlett talk to us today about where we are with infectious disease, and this will help inform our perspective and our mental health during this pandemic. Thank you, Dr. Bartlett.
Thank you so much for having me back. Let me get my share going, and then I can. There we go. All right. Thank you so much for having me again this year. It's the third new school year that we're starting here with COVID. When I talked in 2020, there was just tons of uncertainty. Last year was really exciting. We had learned so much and we were optimistic and we had vaccines, and here we are this year with Omicron variants and poor vaccine uptake in children and an uphill battle to accept any public health measures. But you all have learned so much and have individually and as a community saved thousands of healthy life years of your students and your communities with all of the work that you have done. There's not a whole lot more I can tell you about COVID that you don't already know. So I thought I would add a little bit of a bonus on monkeypox, which for the moment is not anything that we need to be particularly concerned about in schools, but I'm sure you are getting questions, and I want to make sure that you are armed with some good information and sources to look for in the future. I don't have any relevant financial disclosures, but I will be discussing investigative use, as many things for the treatment of COVID and monkeypox are investigational at this time. I want to start by framing this. This is not a surprise to any of you, right? But this is how we should approach the pandemic, in my opinion. Schools are absolutely essential. Learning in person with a teacher who is consistent and not a substitute because they are out with COVID is vital for students. You also provide social and emotional development services, food. It's so important for our children. And for their parents and their caregivers so that they can be confident in the care that their children are getting during the day while they are at work. So I alluded to this, but where are we now in terms of the pandemic? Finally, we have vaccines available for everyone 6 months and up, and boosters and second boosters for some. But the uptake is not, I think, what any of us in public health would like to see. We've got easy access to rapid testing, which is phenomenal, but does lead to inaccuracies in the formal case counts because we're not reporting all of those positive tests. We have now a series of Omicron variants that are highly transmissible, but fortunately don't look like they're any more severe, but we're seeing a lot of reinfections. Sadly, the general public is just over mask use and any other public health measures. And we have switched our reporting to focus on community levels, which focuses not just on the amount of COVID, but the amount of ICU bed availability. And for our children, that's not a particularly relevant measure since most of them don't end up in the hospital. As I mentioned, vaccines are available now for everyone. Just wanted to give you all a reminder that everyone who's 5 years of age and older is eligible for a booster. Everyone who is 50 and older is eligible for a second booster. And it looks like we will have Omicron variant boosters available as early as September. So we will probably all be getting, hopefully, a new Omicron booster when we get our flu vaccines this fall. Vaccine safety has been a concern for many people, appropriately so. One of the things that made the news more prominently in the past year or two was myocarditis, or inflammation of the heart muscle after vaccination. And this was much more common in adolescent and young adult males. And so then when we rolled out a vaccine for the 5 to 11-year-olds, there was concern about what this might look like in that population. The good news is it happens very, very infrequently in our 5 to 11-year-olds. Even my mental math skill allowed me to say that 20 cases out of about 20 million doses is a 1 in a million. So very reassuring information. The rates are higher in our 12 to 15-year-old males and 16 to 17-year-old males with 70 and 105 cases per million. Turns out if you give the second dose farther away than our 3 weeks that we were doing early in the pandemic, you can really decrease the rates of that. Importantly, booster doses in these populations do not appear to have that same increased risk. So boosters are important, and the myocarditis concerns that we see after the second dose don't appear to be a problem for that booster dose. So we can confidently reassure our families that boosting is the right thing to do. So thought I would show you a little bit of data about where we are. These are the latest and greatest updates from the CDC. If you look here in the solid and dotted yellow lines, about 60% of our 12 to 17-year-olds and about 30% of our 5 to 11-year-olds are fully vaccinated. The CDC still doesn't have any data on the 6-month-old to 4-year-old population on their website. Now, 6 weeks into having an approved vaccine for that age group. I do have access to this information for the city of Chicago. And I just want to take a moment to brag a little bit on the city of Chicago. Over on the right, remember, nationwide, about 30% of the 5 to 11-year-olds and about 60% of the 12 to 17-year-olds are vaccinated. We are at 48% and almost 73%. So we are knocking it out of the park, relatively speaking, in Chicago, although I would love to see those numbers higher. But where are we for our 0 to 4-year-old age group? We are at 1% who completed their series, and only 8.5% have gotten that first dose. So in a place where we know people are doing much better than average, our vaccination rates are abysmal in this youngest age group. Where are we in terms of cases? Again, this is the latest data. This is the new community levels, which has a very high threshold for cases to make it a high community level, as well as ICU availabilities. About 40% of the country right now is in a high community transmission. This is the old map that we used to look at with just the virus transmission rates driving the color change. 94% of the country is in high community transmission. COVID is everywhere, but you really wouldn't know it by looking around and seeing the behavior of the people around you. These pretty colors show the marching of the different variants of Omicron, BA2, and then BA2.12.1, and BA4 and BA5. They're coming fast and furious in waves. And again, you can get reinfections with different variants. So I don't need to tell you all that there is COVID everywhere. Most kids who get COVID don't get severely ill, which is wonderful. But these are the rates of COVID-associated hospitalizations. And I just included our youngest children. And you can see that throughout the pandemic, especially back in our Omicron surge in the winter, and then now, rates of hospitalizations of those 0 to 6 month olds is pretty significant. And it actually rivals the rates that we're seeing in our 65 and older group. So, you know, there have been over 1,700 deaths of kids with COVID, which again, is a small number, but we all value each individual child, and no child should die of a vaccine preventable disease on our watch. Interestingly, the multisystem inflammatory syndrome in children, the post-COVID fever and rash sickness that we were seeing, which is in the blue line here, which happened after all of the little waves, appears to be not as big of a deal with Omicron. This black line is the spike of the virus infection, and then the blue line we were seeing historically, MIS-C cases spike about 4 weeks after a COVID surge. Whether this is something about the Omicron variant that makes it less likely, or it's that vaccination, which we know mitigates the risk of MIS-C, who knows, but it is something that we are all watching in the medical community. We don't know a lot yet about post-COVID conditions in children. You know, in adults, there's definitely somewhere between a 10 and 60% chance of a post-COVID condition. In kids, the estimates range significantly. And whether this is sort of fatigue or brain fog, or, you know, just missing out on school and social emotional development, it's pretty significant. I want to give a shout out to Twitter. I am now following you, Bridget, because I have really come to rely on Twitter as a source of the latest and greatest sort of medical information that's relevant to me, and commentary by trusted individuals and occasional cute videos, but mostly for work. And this visualization was done by someone that I follow on Twitter. This morning, data came out in the MMWR that shows what the risk is for different post-COVID diagnoses among children and adolescents. He took the numbers in the text and made it into a nice chart for us to all see. All of these numbers in red are an increased risk of these potentially very serious side effects: pulmonary embolism, venous thromboembolisms, renal failure, diabetes, happening in children who have COVID. So again, you know, we worry about, or we are reassured in the public media often by not having a lot of death among kids, but death is not the only outcome that is relevant for the development of children. I'm going to talk briefly about the latest CDC update. but want to bear in mind that there's a new update coming anytime soon. It was just leaked to CNN, which will probably be easing back on the guidance. Nothing currently in the guidance that you don't know. Get vaccinated, your routine vaccines and COVID. Wasn't going to talk about polio today, but I'm aware that that is now in the news again, right? Stay home when you're sick. Optimize your ventilation, which everyone has done. We're great with respiratory etiquette and cleaning and disinfection. The current strategy for masking in schools is, again, in most areas of the country, we should probably be doing this, but the recommendations, even before they get loosened, aren't as strong as I would like. It should be promoted, and you should always support those who want to mask. Well, we know how important masks can be in keeping down transmission. I don't want to spend too much time on the quarantine and test to stay rules, because again, I think this is going to change about which kids should be excluded from school. But really, we're learning that, again, masking can be very helpful in mitigating kids who are exposed to COVID. And with a combination of masking and testing and contact tracing, we can keep kids in school safely. Isolation rules, again, the CDC is at their sort of 5 days home after you test positive, and then you can be around others wearing masks. But as you know, we're learning with rebound after Paxlovid and the president being positive on day 15 still, 5 days may not be enough to prevent transmission. Modeling studies have looked at different strategies to help keep kids in school. And having a test to stay strategy can help with decreasing the amount of time the kids are missing out in school, and decrease the in-school transmission with weekly screening. But again, these are not cheap interventions, but can be really impactful in keeping kids in school. So again, schools are essential. We have tools to minimize risk, but I don't know if people are willing to swallow it. Death is the worst outcome, but not the only outcome. I'm glad we have great tools to facilitate remote learning and hybrid learning, but really in person is the way to be. And I know I'm running really short on time for my monkeypox work, but I'll just try to summarize quickly. Monkeypox is a virus that's related to smallpox, and interestingly is also related to molluscum, which is something as school nurses I'm sure you're much more familiar with. There've been over 26,000 cases in the US. 26 worldwide, 7,000 in the US. The presentation is some systemic symptoms, fever, headache, muscle aches, and then a rash that develops 1 to 3 days later and progresses through a variety of stages. And I'll show you some pictures on the next page. The illness lasts 2 to 4 weeks, and patients are contagious from the start of symptoms until the rash has healed and a fresh layer of skin has formed. Unlike chickenpox, where new lesions keep popping up, in monkeypox, all lesions are at the same stage, and it goes through sort of a variety of stages until it scabs and the scab heals. There is it's struggled to do public health messaging around monkeypox transmission right now. It is predominantly spreading among sexual networks of men who have sex with men, but that is not the only way it can spread. And it is not sexually transmitted. It's transmitted by direct close contact with the rash or the scabs or body fluids, or on objects, including fabric or surfaces that have been used by someone with monkeypox. Importantly, and of course, just like with COVID, there will be more information to come. There have been no reported transmissions between sort of brief conversations with someone, even close proximity, long duration encounters. Sitting by someone on an airplane with monkeypox has not led to transmission. And there have not been any transmissions in the healthcare setting in the US in this current outbreak. So I think those are the pieces that are going to be important as we think about what this means in schools. The children who have been infected so far have been close household contacts of others, and so that epidemiologic link is really important. But we know that overall with monkeypox, children under 8 are at risk of severe disease, as are anyone with immunocompromising conditions or presence of atopic dermatitis or other skin barrier issues. And we always worry if there's infections involving the eyes, face, or genitals. We have treatment and antiviral medication that is available under an investigational protocol for all children. We have 2 vaccines. We have the good old-fashioned live vaccinia virus vaccine that some of our older colleagues may have gotten. That was the pin pricks and you get a scab and that falls off. And that's potentially contagious until the scab falls off. The new vaccine that we are using, which was approved just back in November, does not replicate. It does not form a scab. You get 2 doses and you are not contagious in the interim. And so you can go about your regular activities. These can be given as prevention, but it can also both can be given as post-exposure prophylaxis. So after a known exposure, it can decrease the risk of becoming infected or decrease the severity of the infection. Neither of these is officially approved for kids, but they are able to be given if needed and if the specific circumstances require it. The recommendations currently, again, based on what we know in terms of if there's someone in the household with monkeypox, we should wear masks around other people, in both the person who's infected and the others who are in the household. Try to limit the number of caregivers, especially if there's a child that's involved. Pick up 1 adult to be the caregiver. Try to avoid direct skin-to-skin contact with the rash since it's contagious. So keep it covered. Wear gloves when you're changing dressings and wash your hands after you care for lesions. We monitor people who are exposed for 21 days, but those who've been exposed can continue to go about their daily business and go to work and school. Testing, although is becoming more widely available, it's only on the lesions. So there's no way to test someone if they have a fever to see if it's going to become monkeypox. So there's a lot we don't know. All the current cases do have an epidemiological link. I want you all to be aware and know what to be looking for. But at the moment, COVID is still our bigger issue, but we do all need to be aware that this is possible to be seen in some of our kids. Thank you so much, and I apologize that I went a little long, and I'm going to hop over and try to answer as many questions in the Q&A as I can, and I'll see you all in a little while for more questions.
Thank you so much. I'm trying to fix my screen, guys, so bear with me. But otherwise, I feel really, really good about where we are and how we're doing. There I am. Dr. Bartlett, don't you worry about running a few minutes behind. We are okay with that, and we are grateful. We really need to hear this information, so that's okay. Many of you have questions. We appreciate that. Again, remember to put your questions in the Q&A, not the chat, and Dr. Bartlett will try to answer them. We will also have a panel discussion following this first session. Our next speaker is Dr. Matthew Young. Dr. Young is a PhD, and he's the assistant professor of psychiatry and behavioral neuroscience within the section of child and adolescent psychiatry at the University of Chicago. Dr. Young, we are so grateful to have you here today. Dr. Young's clinical expertise is in parent-child interaction therapy, which is a behavioral family-based intervention for young children with externalizing behavior problems. He's an active member of the Department of Psychiatry and Behavioral Neuroscience, and enjoys mentoring and advising students, residents, fellows, and early career psychologists. He's going to talk to us today about navigating mental health and perhaps even some behavioral issues as we see them in schools and within families. Dr. Young also currently sits on the volunteer committee for the Coalition for Advancing Best Practices for Culturally Informed Treatment Dissemination. Thank you, Dr. Young, and take it away.
All right, thank you for having me. I'm going to share my slides. All right. So just as a quick update, I have posted a couple updates to these slides compared to what's on the website, but I've sent a new version so that will be uploaded after I talk. I'm going to reference some articles, websites, and links in my slides today, and I will, after my presentation, put links to those things in the chat. Feel free to put any questions that you have in the Q&A. And I'm going to start out by mentioning that I do not have any conflicts of interest related to this presentation. And I want to talk about why navigating mental health issues in schools is so important. Earlier in my career, I used to work in a school setting and interact with a lot of school nurses. So I do know the importance of the role of school nurses in identifying and addressing mental health problems or symptoms of mental health problems within the school setting and overall. Due to really kind of two issues, I think. One is access. School is where the kids are. You all know that. And all the kids who have mental health problems are going to interact with, in that school setting, are going to interact with multiple important adults, and in particularly are likely to interact with nurses at school. I can give you statistics about prevalence of mental health issues and behavioral health problems in schools, but I don't think those are as meaningful as just saying they're very frequent, and I would guess that there is probably no classroom you'll go into where at least one child doesn't have a clinically significant mental health, developmental, or behavioral health problem. Somewhere around 7% of kids are receiving some sort of accommodation for either emotional or behavioral health problems in the US. These numbers are about a decade old, but it's still about the same in most recent estimates. So this is certainly not an uncommon thing. I will also say that that is definitely a very large underestimate of the number of kids that need accommodations or mental health assistance. The first thing that may come into your mind when we talk about behavioral health and mental health problems might be the issue of disability accommodations in educational settings and the right to every student receiving a free appropriate public education and accommodations for any disability they may have that affects their participation in the academic environment. As you all know, that may include things like an IEP, individualized education plan, or a 504 plan. But I'm also gonna talk about some mental health issues that may not fall under disability law when we refer to like IDEA. And some of the more common mental health problems may not meet that definition of a educational disability, but there are some, especially learning disabilities, emotional, speech, communication issues, developmental concerns, autism, traumatic brain injuries, things like that that come to your mind often. I'm also going to talk about mental health issues that are actually maybe even more common than those, like depression, anxiety, and experiences of adverse childhood events. So let me start there. You may be familiar with the literature on this. I just think it involves, it's so important to stress that one of the biggest risk factors for not only mental health problems, but also physical health issues and learning problems are the environment that surrounds the child. And childhood adverse life experiences, like some of the things that you see on the screen here, are unfortunately more common than we'd like them to be. They are often related to factors that you working in a school setting don't have much control over, because a lot of them happen outside of the school setting. Some of them are not modifiable, when we talk about things like whether or not you have a genetic predisposition to a mental health problem, or whether something happened to you in the past that we can't undo that it happens. But other things are modifiable and really amenable to intervention. So the thing that I want to stress the most is many of the kids that you're going to be working with have experienced some sort of adverse childhood experiences, trauma, abuse, neglect, adverse environmental experiences. And those vary quite a bit depending on where you are and the part of the country you're in, what kind of neighborhood kids are from, what kind of resources are in their community. But one thing they all have in common, as Dr. Bartlett mentioned a few minutes ago, they've all experienced a big disruption in their lives by the pandemic, just like all of us. And I want to highlight the effects of that a little bit in a few minutes. When we think about interventions for mental health problems in school, estimates suggest that actually just about an equal number of kids receive mental health services in specialty care settings, like where I work at University of Chicago Department of Psychiatry. That might be your typical type of place you may think of when kids get mental health care, therapy, evaluations, neuropsychological testing, medication interventions, things like that. But an equal number of children in our country get mental health interventions in the school setting. It's almost the same amount. It's fairly equal. And their primary location is at school. So I want to talk about 3 levels of intervention or prevention methods, and I'll highlight each of these in just a minute. You're probably familiar with this. We talk about tier 1, tier 2, and tier 3, or primary, secondary, and tertiary interventions. So within schools, I'm going to talk about each of these briefly and give you some examples of what they may be. So example would be a primary intervention. That's the bottom of our pyramid here. These would be things that apply across the whole school, either for everyone involved or all employees or all students. It might be a training, it might be a district-wide policy that addresses how a specific mental health issue or a risk factor. It may be a curriculum that focuses on addressing mental health broadly. It might be something like a bullying prevention program where we talk about we're going to apply this to everyone because the net effect across the community is improved outcomes or prevention of worse outcomes as people get older, as kids get older. Secondary interventions or prevention would be something where we identify someone who is at risk for a problem or a symptom based on some known factor that increases their risk. It may be early or prodromal symptoms of a mental health problem. It may be screening kids for a psychosocial or behavioral risk factor that we know is associated with longer term, more difficult outcomes. And then applying some sort of either brief intervention or preventative measures based on that known and identified risk factor. Tertiary interventions or tertiary prevention methods are really for an identified individual. So this would be something like an IEP or identifying a student who is exhibiting a mental health or behavioral problem in the school and providing an intervention based on that individual student's needs. So it's really targeted towards a child that's already affected. That's kind of what I do the most. So I'm going to talk more about that in the time that I have left. So as Dr. Bartlett mentioned earlier today, COVID-19 is everywhere. You're all aware of that. I want to talk about from a mental health perspective, how this has affected kids. First off, prior to the onset of the COVID-19 pandemic, we knew that rates of depression, anxiety, and suicidal thoughts among youth, particular teenagers in the US, have been rising in a significant way. We don't necessarily have one answer as to why that's happening. There are a number of factors that very likely contribute to that. One of which is, I think that there is some validity to the idea that these mental health problems are actually happening more. Like it's a true increase in the rate of mental health problems. I think another significant factor is an increased awareness and increased recognition of what symptoms of mental health problems are. Also some, although not complete, decrease in stigma around mental health problems, in making it more likely for folks to be willing to talk about and recognize these issues. Then we had COVID-19, and this was obviously clearly a stressor for everyone, from kids, especially youth, school-age youth. This was a massive disruption to their daily lives, particularly in the early stages of the pandemic, where there were lockdowns and remote schooling. And I want you to imagine, if you have kids, you already know the answers to these. But for those of you that may not, think about what happened when kids were abruptly disrupted from their daily routines in school, their social relationships. They're more likely to be alone. They're more likely to be by themselves, isolated, disconnected from the things that matter the most to them, lack of social contact. All of those things are really describing risk factors for developing mental health problems like anxiety and depression. A survey that's now over a year old, a national survey called the Adolescent Behaviors and Experiences Survey, which I'll give you guys a link to later, found that over 40% of teenagers in 2021 were endorsing persistent feelings of sadness or hopelessness. That doesn't mean that 40% of kids have clinical depression, but 40% of kids, when asked, do you feel sad or hopeless several days a week, said yes. That's an alarmingly high rate. I think everyone would agree. And not surprisingly, when we survey parents or primary caregivers, most parents say, I'm worried about my child's mental health and mental well-being. What have we seen since the acute phase of the COVID-19 pandemic transitioned into this current phase that we're in? We've seen that getting kids back to school, as you all know, has been greatly beneficial. And as Dr. Bartlett mentioned, I think schools are definitely an essential place for our kids for so many reasons. But it's also led to identification of and a real lack of resource for what do we do about kids coming back to us who are evidencing new issues related to their mental health. I'm going to talk a little bit about some of those common symptoms that you can see related to mental health in just a couple minutes. But I also want to mention one other thing. It is really positive that rates of hospitalization, serious illness, and death are lower for kids who are infected with COVID-19 than some other age groups. And that's a real great positive. However, I want you all to think about this, which I think is really striking. It's almost a year old now, this statistic. But in October of last year, the NIH estimated that over 140,000 kids in the United States lost either a parent or a primary or secondary caregiver during the pandemic. That was over a year ago. I don't have updated numbers, but we all know that those numbers, I'm sorry, not over a year ago, almost a year ago. I don't have updated numbers yet, but as we know, those numbers have certainly increased by a lot. There are also stark disparities by race and ethnicity. Children in communities of color, as you're all aware, have experienced much, much higher rates of infection, serious illness, and death. And so that's something to keep in mind based on the populations of children that you work with. The next thing I'm going to talk a little bit about is, what do we do? So I want to be optimistic and let you know we have extremely effective interventions for most mental health problems in kids. And there are things that school personnel, particularly nurses, can do to really help kids out a lot. The first thing that you can do is recognize and identify mental health problems. That is really an essential role because school nurses in particular are somebody that interacts with children who are struggling at school so often and so frequently. The high frequency problems that you may see in school settings, and this varies depending on age, but really the most common things you're going to see are things related to like anxiety, depression, ADHD, post-traumatic stress symptoms for kids who have been exposed to abuse, neglect, or traumatic events in their lives. One thing to look for is it's not necessarily your role as a school nurse to identify, diagnose, and treat every mental health problem in a kid, but essential role is identifying these kids and noticing who does need a closer look, who does need some intervention. And so I want to just mention a couple sort of warning signs you may notice. If you see changes in a child's behavior or in their interactions with others, for example, withdrawn, avoidant, or sad behaviors, you're thinking about depression, right? Also, changes in social relationships, not interacting with friends as much, experiencing interpersonal peer conflicts, or more serious things like, for example, talking about death or suicide. Another risk factor to look at is abrupt changes in behavior. So for example, increased anger, irritability, or outwardly directed behaviors in kids where that's not typical for them. And I want to mention one more thing. I mentioned thoughts of death and suicide, and that's one that really scares a lot of people when they hear that topic. I want to stress one thing that's really important for you to know is that there is no evidence to suggest that talking to a teenager, it's more typically teenagers that express this, about thoughts of death or suicide is not likely to precipitate them acting on those behaviors. Just like talking about it is not dangerous. Talking about it is often something that can help identify which kids are in serious need for help. For life-threatening issues, it is most important to make sure that kids get outside referrals. Oftentimes you start with their pediatrician, but also to mental health professionals like myself and the psychologists and psychiatrists that I work with in other types of settings to deliver effective evidence-based psychotherapy, family therapy, assessment, identification of needs, and when warranted, also medical and medication interventions. So, I think the at-risk kids can be identified really well at school. I think the primary and universal school-wide interventions are essential and really great at preventative. And then when you see kids who are having really significant individual mental health problems that are affecting their functioning, usually that is the time that child's going to need more intervention outside of the school setting. and you're really an essential person at helping to identify that. Most mental health problems, most adults that have mental health problems note that their mental health problems started by the time they reached like age 14, about 50, more than 50% before onset at age 14. So these things are most common to start around the age where they're going to be in school settings. So it's essential to keep an eye out and screen for these problems, provide resources that are available in your school, but also for kids with really serious mental health problems, referring out for additional services. Here's my contact information. I'm going to put some of those references in the chat over the next few minutes so that you can look at them and access them. And I'll be happy to answer your questions later on during the Q&A.
Thank you so much, Dr. Young. Such important, valuable information. We are running a few minutes over, but that's okay. The most important information of the day, in my opinion. And we, again, thank you. We will have many of your questions answered during the Q&A and discussion at the end of this session between 10 and 10:30. We might go a little over 10 a.m. for this third speaker for this morning, but I think it's worth it. Taylor Mills Mossing is a social worker who I just adore. She works with the Kovler Diabetes Center. We recruited her from another academic institution in Chicago to really spearhead a new effort to support individuals, children, families, and adults with diabetes. She's a dedicated outpatient diabetes social worker with us at the Kovler Diabetes Center in our outpatient clinic. Taylor's been working with Kovler for over a year now and has collected some impressive and important data, from my opinion, certainly that we can learn from in a variety of healthcare settings. Her passion is working through advocacy with those who are impacted by chronic disease and help them thrive rather than just survive. Taylor's going to talk to us today about navigating mental health issues from a practical standpoint. And many of our schools have some amazing social workers. So Taylor will talk to us today about some practical tips in addressing the needs of our children from a mental health standpoint. So take it away, Taylor. Thank you for joining us.
Oh, hi. Hello. Let me just share my screen real quick. Okie doke. So Peggy, thank you for the wonderful introduction. That's not the beginning. So my role here is to help kind of show how to navigate these mental health issues, especially that the person speaking before me, Matthew, was talking about. So mine is more kind of how to work with those, as well as identifying them to make them seem like they are something that you guys will be able to recognize. But as also previously mentioned, like, this is not something that you are supposed to identify and then go all the way to the treatment. Like, there are other support systems in place that can help you once you find these kids that are in need of these services. Full disclosure, I have no any type of conflict of interest with this for this presentation, just to point that out. So just to kind of offset real quick, my role as an outpatient medical social worker is that I am considered kind of like the navigator to be whoever the best person to collaborate and help our patients within our entire team, whether that is for like 504 plans, advocating for them at the schools, mental health issues, or even something as simple as like medication issues. I also provide resources, an abundance of variety of resources. As mentioned before, my big thing is encouraging empowerment, advocacy, and then prioritization, especially in our low income communities. There can be multiple layers of issues happening all at once. And so it's trying to kind of use like, Maslow's hierarchy of needs and trying to address what's most important, and then being able to then address things later on that once they've gotten their basic needs down, that we can do those. And then obviously, as a social worker working with chronic illness people, is addressing and finding out what are the barriers to why they're not getting the care that they have access to, or that they're just not simply doing it. Like what is the issue? Sometimes it's burnout, sometimes it's lack of help at home, sometimes it's lack of just transportation to get to the appointment. So that's something that I help figure out. I obviously do a lot of assistance working with DCFS when it comes to medical neglect, and then working with you guys as school nurses and other social workers at the school, working on those 504 plans to make sure that especially the kids with the chronic illnesses get the proper accommodations that they need to succeed in school. Similar as we talked about before, I kind of looked at more as external and internal factors of mental health issues that can happen with a child. External factors, I would like to count the CPS strike. I think that that was a huge thing that happened with children, especially it happened right before the pandemic. And that has been another reason why kids weren't able to be in their school setting, have their typical structured day, and also have their just normal socialization skills built. Another thing is, I'm sure like children absorb more than we know. I'm sure they were able to see like all the stuff that happened in just 2020 with the Black Lives Matter movement, immigration, the medical disparities that were happening within the COVID pandemic. And then on top of that, maybe there's social issues happening already within their families, which is family dynamics, such as abuse, neglect, or traumas, having a lower socioeconomic status, which is lower access to resources of any kind, trauma, abuse, and grief, especially either because of the disparities in medical care, of deaths due to COVID. And then with these kids that I work with, they all have other family members, sometimes with chronic illnesses too. So that puts them at higher risk, or they are in a more gun violent area that they have experienced some more traumatic deaths. And then of course, for those chronic illnesses, I think that's just an extra layer that a child has to deal with compared to another child. We're talking about puberty here. And then thinking about from school shutting down from 2020 to us almost kind of, knock on wood, fully opening up now to 2022. That's 2 years of a child missing of like social interaction, and even maybe not even with taking in all the education that they were supposed to be getting remotely. So you're looking at sometimes thinking of that as like a third grader, and you don't see them again and they're supposed to be a fifth grader, but they're still probably coming in as the mentality similar more to a third grader than a fifth grader. So developmentally, sometimes you want to keep that in mind, that they really missed out on some developmental like learning stages, especially socially, and even with education as well. Some internal factors that can happen for that you guys would notice within the school is managing the disease. Sometimes you can see it happening alone without the parent being involved. And this is something that I work with the parents to make sure that they definitely are involved, and helping them advocate for their child to make sure that they understand what is needed for their child at school. You can see hygiene being impacted, bullying, lack of social skills, and building friendships, like I said before. The pressures of schoolwork versus there was not really any pressure before, versus now there's like too much pressure to like catch up, or let's say there's like it's a sixth grader to an eighth grader, so now they need to worry about testing into a great high school. Psychosocial factors such as perceptions of themselves and what to think about others, and being able to have perspectives of other people. And then another big thing is confidence and self-esteem that can be impacted because they've been just kind of stuck at home and not being able to build up those decision-making skills and social skills where they can be proud and have that identification of themselves. Some signs of mental health issues that you could see, specifically related to like depression and anxiety. And this list is not limited to those. And as we said before, that could become a child being recluse or withdrawn. They could be misbehaving just to gain attention, even if it's negative attention, which means they could maybe not be getting a lot of attention at home. They could be starting to connect with poor friendship groups that lead them to poor decision-making activities and such. There could be poor performance in school, lack of participation in extracurriculars because they missed out on like 2 years of kind of discovering that. some neglect happening at home, you would see poor hygiene. And then you could also see little to no desire to participate in whether it's their healthcare within the school or within the school education program. When would be a good time to reach out to a patient's medical care team? So this is where like my profession and my team where I work with at the COVID Diabetes Center, especially with the kids with chronic illnesses, can certainly help you. And this is something that I want to emphasize, that like you guys do so much already, as we've talked about already before this morning, and that we want to be able to help you guys and aid you guys and be able to have all these kids succeed. And it doesn't work when a kid is burned out or a nurse is burned out or one of the medical people are burnt out. If we work together, I feel like it will make everything so much better. And just work more cohesively. So obviously having clear understandings of 504 and IOP plans, I'm sure you guys know the differences really is 504s help establish like appropriate accommodations based on an illness. Like for diabetes, I'm very familiar with how they need to know what their medication regimens are, make sure that they have their snacks or they have the medication stored in the school, or whether that the student knows to bring it back and forth from home, allow them more bathroom breaks because they need to take more water breaks, things like that. And just kind of advocating for those kids for doing that, especially sometimes maybe a teacher isn't aware of that, and bringing awareness that to the teacher would help as well. And then IEP plans can more accommodate for like learning disabilities or others such as like ADHD. There can be issues that you can contact to us if the child is not following the plan, such as like they're not coming in. I'm going to always relate to diabetes just because that's kind of my specialty. They're not coming and checking in before lunch to do their carb counting so they can get their insulin ratio. Or if you're noticing signs of neglect or abuse, or like the parent not having any concerns when you call and say there's high sugars and they're just like, it's fine, let it go. And that's where we can also help. Especially some nurses don't have a lot of experience with diabetes. I personally didn't before coming into the COVA program, so I'm still also learning myself as well. But we would love to be able to provide you that education to help you guys be able to feel comfortable in taking care of these kids that have these chronic illnesses that are very important to manage. So please, always like your PCP and then like us as endocrinologists and other teams with the chronic illnesses, like they're always happy to help with education and giving you guys assistance to make sure that you guys can succeed and mainly just feel confident in knowing what you're doing and you're helping manage this child's illness or anything. So this is also too another resource you guys can use, the school social worker. I would think that they are understanding, just like the nurses, often spread among other schools or often seeing way too many kids in one day. So they are also trying to kind of juggle this balance of trying to make sure that they are helping those individual children at the same time, not risking burnout and stuff. So working with them could be super helpful. They are often someone that you could refer to them to help kind of find out more what the issues are going on with a child when it comes to any of those factors that we talked about, where that shows that there could be something happening going on, whether it's externally or internally. They can aid in collaboration with other school parties, whether that's with the parents, with the medical team, with the pediatrician. They can help improve communication and letting them know that this is something that is necessary to happen. That is something our team can also help with. They can help identify the external factors that maybe we're not seeing at home, that's at school, and that's happening at home, and that's something that's out of our control. But what can we do to at least help them be able to thrive in the school setting as best we can? And then help the social workers also will provide like coping skills and defense mechanisms, and also refer them out to other resources accessible within the school settings and with outside of the school setting. Just a big thing, social workers, we love to collaborate. We notice the recognition and that collaborating gives all parties involved an amazing sense of confidence and understanding and just learning, and continuation of learning to be able to provide the best care that we can for all of the children's regardless of our work setting. So a medical social worker as me, I'm happy to work with a school nurse or a school social worker when it comes to a child that needs some extra assistance, because we want to make sure that they, I kind of like to always say is I want them to thrive, not just survive. And so getting us involved, we are going to do what we can to as best as we can within our reach to make sure that all of the kids impacted or even not impacted are doing well in school, especially after coming back from this pandemic. And it'll be really interesting to see kind of what other types of things come up, issues or other types of like factors that cause because of this pandemic that will impact a child's upbringing and how they will kind of grow into adults. That's something that I'm really curious about, especially with that socialization that they missed out on. This is something that we can definitely watch for and learn and experience and hopefully be able to provide as best we can for all the kids. I have questions. I guess I'm one of the few that kind of zipped through this. We can talk about questions in the panel. But like I said, I'm Taylor. I work at the Culver. So if you have any diabetes patients, that's my specialty, but I do work with a lot with just patients with chronic illness in general. So I'm happy to help with anything or any questions if you have about those.
Great, Taylor, thank you so much. Taylor's truly passionate, as you can see, and is happy to answer some interesting and practical questions for us. I'd love for our morning speakers, including Dr. Chacho, to join us now on camera. And I plan on starting with Dr. Bartlett, but Bridget, I'd love for you to join us too. And we can walk through some of these questions that folks are asking, I guess, first about COVID in general, right? So if we start with sort of the beginning of the day, what are some of the questions that are coming up that are valuable and important? So Dr. Bartlett, you can see the Q&A. Do you want to read this first one? What has been observed regarding vaccine reactions for children? Did you see that one from Lori?
I did. Thank you so much. So, we have seen a little bit more reaction after the second dose than the first. But reactions after the booster doses are not particularly different than either of those. It's 5 months from when they got their last dose. And so we are not seeing anything more severe than the sort of arm pain, fatigue, a little bit of fever that we were seeing before. So very reassuring.
Sure, I appreciate that. Bridget, this question is for you. It's from an anonymous attendee, which is great and welcome. Many school districts underappreciate the role of school nurses, and some nurses feel like they're not being respected. And so it's hard when you see some school nurses are feeling as though their positions are being replaced by unlicensed personnel. Or LPNs, perhaps, which is a licensed practical nurse. What are your thoughts about working under the guidance of a school nurse? What is the school nurse's role to sort of manage, oversee, and I guess handle liability related to unlicensed personnel in the office?
That's a great question. I would direct nurses back to the Nurse Practice Act, as well as the scope and standards of practice of school nursing. The new edition just came out last month from NASN. Both of those are excellent resources. If you are concerned about delegation or things that you can and can't do under your license, the Nurse Practice Act is 100% where you need to go. In terms of not being valued, again, I would say pull together your data, because one thing that we have seen in the school environment is that nurses don't have that same role that we have in the acute care setting. So put together your data to show what you're doing every day and the students that you're caring for and the conditions you're managing, and use that to help advocate for your the way that you are essential to the district.
I appreciate that. Thank you. Um, Taylor, this one might be for you. Bridget, it certainly could be for you as well. Any questions, or excuse me, I apologize, any suggestions on how to work with parents who will not allow the nurse or care team to reach out to the child's care team? Whether it's they won't sign the consent to share information, but just in general, the parents don't want the school to reach out to the clinical care team. Bridget, why don't you start with that first, and then Taylor, maybe you can jump in.
Yes, I definitely would want Taylor to jump in here. I would say take a multidisciplinary approach to this and utilize the members of your school team, your school psychs, your school social workers, counselors, to form that relationship with the family, because it may be that that's really where you need to do your work, is to build that trust with the family so that they feel more comfortable disclosing some of the things that are going on outside of school. Taylor, do you have any other suggestions?
I'm just one thing that kind of comes to mind is if they're kind of being closed off at school, they're probably being closed off with us in the medical practice as well. So we probably are also dealing with similar issues of trying to get in contact with you guys at the school. And so we will be doing the exact same thing, is trying to advocate that we need to talk to the school. We want to make sure that your child is being taken care of at school. So I think it kind of goes hand in hand, is that us working with the parents and then that collaboration of us working together is so important, and trying to get those parents that understanding. And then unfortunately for us, sometimes that can be considered part of neglect, because that's a huge part of your day, of especially for our diabetes patients, that they're not getting proper care for. So that is something that we avoid to bring up, but if we have to, we will tell them, like, that is something concerning to us if you're not letting us talk to the school. And then that usually hopefully gives us at least the opening to get to talk to you guys, and then the doors open. So just continue, like I said, and find those people who love to advocate, and call them, and we're happy to collaborate. Social workers always love to collaborate. We're not selfish, otherwise we're in the wrong profession.
Yeah, yeah, and I think Taylor, thank you so much. And I think just a valid question is, asking the family maybe, why, what's their perspective, or what are their fears and concerns. Often there's a lot of fear and concern around sharing medical information with the school, that it will be a permanent part of the chart. Dr. Young, I'd love for you to speak to this in terms of your experience. What I could see there being perhaps more fear, stigma, concerns around mental health issues with kids. What has your experience been, or interaction been, with families that are maybe hesitant about you talking to the school, and vice versa?
Yeah, that's a great question. I think it is really important. I think that I know for sure that when I communicate with school teams about the kids that I work with, it aids me tremendously, because that's such an important environment that kids spend so much of their time in, that, kids are different in school than they are at home. So regardless of what age they are, I know that I'm getting useful information about how they're functioning in a different setting that their caregivers won't have. There are some really relatively clear, and in some places quite strict regulations about sharing mental health information. So there's HIPAA, and I'm covered by that because I work in a medical setting. So like me sharing information with someone who's not the patient, we'd have to get written authorization from the family to do that, which is, part of what we do. And schools would fall under FERPA as opposed to HIPAA, but you all are familiar with that. In particular, like one thing I've noticed, I've been here in Illinois for about 7 years. Illinois actually has a much stricter mental health law than many other states. So for those of you that are in Illinois, we need an additional level of permission specifically stating that we're sharing information about mental health. And so that can be a barrier if a family doesn't want to share that. If the patient or their family member doesn't give us authorization to share that information with school, that does limit a child's care sometimes. I do think that stigma is a huge, huge factor in that. I am trying to be a big optimist and notice that in the past year or so, particularly our teenagers, learn from your teenagers, they're very smart. They are really being much more open, honest, and communicative about their mental health issues, their mental health symptoms, their struggles, their experiences, in a way that those of us who are older, maybe it wasn't culturally as accepted. So the most important thing I think is listen to the teenagers, because they're really becoming remarkably well versed and open about these topics.
Thank you, Dr. Young. Back to you, Dr. Bartlett. So lots of good questions about how nurses can sell or educate about recommended uses of masks and the validity and the reliability of data out there regarding mask use. This is a toughie, and it's not something schools can push at this point, depending on what their school's policy is, but we can recommend masking. And so how do we recommend masking, or how do we educate families regarding maybe the pros of masking if it's something the family's interested in? What kind of data can we provide them that's really solid and doesn't feel anecdotal or made up?
Yeah, no, there are definite papers out there that show the impact of masking in schools, and I'm happy to throw some links in the chat. It's not.
Thank you.
It's not up for question. We're not lacking for data that masking helps prevent transmission. It doesn't prevent all transmission. Vaccination doesn't prevent all transmission infections. It's the use of multiple strategies at once that helps keep people from being sick and keeping kids in school. I don't know what to do with the world. I'm very discouraged by our lack of a community spirit and willingness to accommodate other people. There are very few downsides to masking. We know that kids, even infants, can appropriately learn what facial expressions mean, even if people are masked. And it really is the triumph of individualism over being part of a community. And I don't know how to get that back. And I don't know how to start prioritizing children and learning and health. It's been a pretty discouraging pandemic, and I'm sure you guys all feel it as well.
Thank you for that. Any scientific papers put in the chat? Fantastic. We might even have you put some additional resources on our website after this. So I think we have some really, really good questions here. One question I had is, how can you work with an administration who maybe isn't supportive or understanding? Bridget, I'd like to get back to the question or the point that you brought up regarding collecting data. So pretend I'm a school nurse, right? It's like my first year on the job. I love the idea of giving folks an opportunity to have a mentor. How do you collect data? So really it's about, at the very least, tracking your hours, right? How are you spending your time throughout the day?
Yeah.
Data about the number of kids with chronic disease in your school. How do I get that? Where do I get that?
So I would start by going to the NASA website and clicking on their Every Student Counts page. And they have a wonderful resource tool there that lists all the data that they're looking for. So that's like your starting point. So that shows you what you should be collecting. So then I would work with your IT department. I know we use Infinite Campus. I know that's one of the big records keeping programs that some schools use. So we have a bunch of experts here in the district who work specifically with that program. They are amazing. Make friends with them. And I sent that spreadsheet from NASN to my IT department, and I said, can you guys make me a report so that I can capture this data based on what we have in our system? And so they're working on that for me right now. But I would say make friends with them. If depending on your online platform, it probably has training videos and training modules that you can access at any time. So educate yourself on how to run those reports so that you can filter the information you're looking for and get it together in a way that can be understood by the people that you're presenting it to. So I would collect data on a weekly or a monthly or quarterly basis and be ready to present that with the lens of, I am essential to the students and the staff of this building. Here are the things that I'm doing. I want you to see so that you understand my role.
I appreciate that. I would love, Taylor, for you to share kind of a best practice scenario, whether it's diabetes or children who have diabetes and ADHD or what have you. But I'd love for you to share kind of a best practice story with your communication between the family and the schools, if you could, if you can think of a scenario where it's really working.
Yeah, I would say that there's one situation we had where the parent simply didn't know that they had to tell the school that their child had diabetes. It's just sometimes you just don't think about it. You think like this diabetes is only needed to matter within the medical care system, and it doesn't matter in the school system. And so what? So there's a lot of education, just making sure that they know that they have access to these resources at school as well. And so typically when it's happening like that situation, they are more than willing to giving us access to talk to them. And then I know as Kovler, we have amazing diabetes educators that are willing to set up a meeting with a nurse to help them educate and figure out how to manage even this child specifically, their insulin regimen that needs to be done at school, how to do carb counting, with the parents' consent, of course. So that's usually one of our better case scenarios, is when sometimes they just simply don't know that they have access to these resources at all the schools. And then being able to have that trust on the medical care team and the school team. They are seeing us working together and being able to get all these things connected. And our team, I know our clinic definitely is very much approachable and very able to be communicated with when there's questions involved. So we try to show that and show that collaboration so the parents see that, and then the parents are more willing to like let us have our conversations together to help their child.
I appreciate that. Thank you. Dr. Bartlett and Dr. Young, I'm going to have each of you answer these questions, but I think that the value of having our Comer Children's Hospital experts and our University of Chicago experts here is that people want to know, in what case would I like call you or refer a patient to you, right? And what types of patients would we refer to you and why, right? So how do we get in touch with you? Like if you're our local experts, if you will, for the Chicagoland area or even, abroad. So let's start with you, Dr. Young. Are you seeing patients virtually? What types of kids do you see? Are you taking new patients? Let's talk about this. You seem like a smart guy.
Yeah.
You're a psychologist.
Let me try to give you some good news. But I'm also going to give you some kind of depressing news. I saw a couple comments in the chat about, wondering about where our resources, and what do we do to support kids? And so we, being optimistic, I'll tell you that we know that there are really effective treatments that can be done both in schools, but outside of schools as well. Myself, I'll speak from my own experience the last couple of years, both myself and the clinic that I work in here at U of C has been far busier than ever before. And talking to regional and national colleagues of mine, that is not a unique experience. Some of it is this shared stressor that we all went through and we all experienced, and we all needed additional mental health support. Some of it is the greater incidence of some mental health symptoms being reported by kids. Some of it is, again, like I mentioned before, the greater awareness and willingness of folks to speak up and talk about these things, which are all wonderful. But we definitely have a national mismatch in the number of kids who need mental health supports and the number of folks who are there to provide them. That's a social and societal issue. And so, you know, I want to take a minute to just say, you can all help by getting involved in local and national efforts to help support and expand access to mental health, education, and treatment. I think that typically for a child who's been identified in a school setting as potentially having mental health struggles, the consultation with the student and the teacher and the team that works with the kid is usually your first step. Oftentimes, I would say you're most likely to get some most immediate assistance by referring kids, talking to their parents, and referring them to their pediatrician. Pediatricians provide a lot of the mental health care in our country because there's not enough people like me and my colleagues. And they often can help manage things that are less acute or less severe. And then they're often really in a good position to help decide which child needs a higher level of intervention. However, anything safety related, talking about wanting to be dead, hurt themselves or someone else, suicidal or homicidal thoughts, things that are obviously very serious, you would want to get help immediately for kids. So we wouldn't want to wait to say, oh, call the parents, call the pediatrician. Those things you act right away. And there's really no downside to acting quickly on those kind of things. It's not likely to cause more distress or harm.
I don't know, I have a whole lot to add because clearly what work that is happening in our psychology and psychiatry clinic is really the important. Our ID docs are always here to answer questions, and hopefully we won't need to be fielding a lot of monkeypox related questions, but we are here to help with testing. But certainly the mental health needs trump all of this.
It looks like we lost Peggy for a minute. I know somebody asked me a question in the chat and it wasn't in the Q&A. It was about grief support. And I just wanted to quickly throw out that I know University of Chicago does have a grief support group for adults. And then for children, a really common you wouldn't think of this, but a really good grief support group would be like hospice agencies, specifically like Seasons or Journey Care, because they're very good at working with children who are dealing with the death. I think Seasons even has like a kangaroo camp, which is a camp for kids who have lost a parent or someone or a guardian. And then going to those, and then I think there's another resource called Chicago Survivors, which is very focused more on survivors of relatives or people who lost family members to gun violence. And then there's also the American Counseling Association, where you can hopefully find maybe a counselor in your area that specializes with gun violence and trauma to help with that. And so I hope those resources are helpful for you. And that's something that our medical team can also help you with, connect you with.
I am happy to jump in and I got several good questions. I do want to answer one of the monkeypox questions, which was in terms of level of concern and getting child welfare involved if there is a case of monkeypox in a child that's a close contact of someone. And that is a very reasonable question to ask, because the predominant spread currently is close contact, generally of a sexual nature. But this is not a traditionally sexually transmitted infection. And so, children are much more likely to become infected by touching a surface or having someone who hadn't washed their hands before they touch the child, or sharing towels and things like that that are relatively benign in the child protective services setting. And so, it shouldn't automatically be a question of, do I need to worry about abuse in this child? I think I would say, if the child happened to have exclusively anogenital lesions, then potentially that is a different story. But auto inoculation is also very common. So a child who has a rash on their skin and then scratches their backside, can get transmission there. But it also speaks to the importance of giving good advice to someone who was diagnosed with monkeypox in terms of how to prevent transmission to their household contacts.
Thank you. I appreciate that. I feel like we've answered so many good questions this morning, but I wanted to be sure, and I apologize, I zipped out for a sec. It was very strange. My Zoom glitched out for a moment. Dr. Bartlett, were you able to answer the question regarding why you would see a child with a infectious disease and when you would see a child with infectious disease?
Sure. The common things that we see in our outpatient setting are concerns with children who have recurrent infections, or kids who have sort of a prolonged febrile illness that no one seems to be able to sort out, and often just kids who are being a lot of kids with recurrent ear infections, recurrent colds, which many people have forgotten was a thing now that we've had 2 or 3 winters with blessedly few upper respiratory tract infections. But we are always available and happy to help try to be an extra set of eyes to sort things out for people.
Thank you, Dr. Bartlett. I appreciate that. If you are experiencing concerns or questions, we're always here for you. We'll be here for you, of course, for the rest of the day. We will continue to follow up with you. Our goal really is to ensure that we're connecting with school nurses throughout the year, and maybe not just once a year. So after this, we hope to maybe do some Facebook Live events on some particular topics of interest to you, like infectious disease, like how to navigate school nursing, and also how to handle mental health in the face of a pandemic. So thank you for joining us for this first session